I think one of the biggest misconceptions about hospice care is that we're giving up on people. We're not giving up. We're not taking away hope. We're refocusing their goals on how they want their time to be with their family and with their loved ones. That's giving hope, and that's enriching life as much as possible. Hospice is appropriate at the time that the patient, family, and doctor's goals have aligned with stopping life-extending or treatments that try to cure what the underlying process is. Now, that's a very negative way to say it. You might also say that the timing for hospice is when a person who has a shortened life expectancy that's less than 6 months chooses to focus solely on quality of life and, for the most part, spending time at home with their family. They're choosing to make the hospital and the medical system less of their day-to-day life. They still get medical, nursing care, psychosocial care, spiritual care, but they're making a very informed decision to focus on quality. A person is eligible for hospice when 2 physicians certify that they have 6 months or less to live. This can include a wide variety of diagnoses: cancer, dementia that is very advanced and is showing signs of complications and terminal decline, congestive heart failure that is very advanced and for which people are very symptomatic, end-stage respiratory diseases that might include emphysema or chronic obstructive pulmonary disease are also included. What we try to do in hospice is align hospice's philosophy and treatment goals with the patient's clinical condition and their goals, so that if staying at home is important, if quality of life is important, if acknowledging that their time is short, that may be measured in months, that hospice and the hospice philosophy will very likely be able to serve them well, not just during the time that they're living, but also through bereavement for their family and loved ones. A person who's on hospice will have a nursing case manager who sees them at least once every 2 weeks. As their needs increase, their nursing visits will increase. Individuals who need assistance with personal care, for example, bathing or meal preparation, might also have a home health aide included in their care on a regular schedule so that the person gets to know them and they know when to expect that help. Many patients on hospice don't realize that they also have the services of a hospice social worker and a spiritual care counselor available to them. A social worker can help them and their family with myriad factors related to adjustment as they decline and what their needs are above and beyond their nursing and medical needs. A spiritual care counselor not only can address specific religious practices that the family and the patient want observed, but many questions about what life meaning is, what their legacy will be, and how they can incorporate meaning into their dying process. Many patients on hospice also receive a volunteer. I was a volunteer for hospice when I went to medical school and sat with patients while their caregivers would go out to church or maybe out for lunch or take a break. I also helped with family members when I was a hospice volunteer. It's important to remember that communities are encircling the family and the loved ones for hospice care, and that we include volunteers in hospice as well. All hospices also have a cadre of volunteers who help patients with individual tasks such as sitting with them, all the way to things like maybe installing a bar in their bathroom to help them get up. Our volunteers might help a patient to touch a horse for the first time, to go fishing. Other volunteers might mow lawns or stack wood before winter. But the volunteers are really representative of the community coming around this family, coming around this patient in their time of need, and individualizing and personalizing the services needed for them. As a physician, my role on the hospice team is to oversee the entire plan of care for the patient in conjunction with their immediate care providers and also their physician. I also have the privilege of visiting patients in their home or wherever they may call home. That may be a nursing home, an assisted living facility, or in an actual traditional home, both for my own practice and how fulfilling it is, but also to pull together with the patient, the family, maybe even a nurse or social worker or spiritual care counselor who may be there with me to define what our next steps are. Where are we? Where are we going? What do we need in the home to make people feel safe, to make them feel comfortable, to ensure to them that they're going to be well taken care of as their days become more and more limited, as they die. I've had the privilege of meeting with people in their homes just a day or two before they die. I've also met with patients very soon after referral when they might tour me around their house or their garden, and we get to know each other. We get to develop trust, and that allows me to come out, if the physician and the patient likes it, 2, 3, 4 months later and see them again, to speak about the important things, their comfort, their family, their loved ones. As a physician in hospice, I don't have a clock ticking on my visit. I'm able to really address their questions and their concerns fully and completely, unlike really any other part of the healthcare setting. A person who wants to enroll in hospice will begin by having a discussion with their doctor. They may also begin by hearing the recommendation that they enroll in hospice. Hospice providers come to patients' home. I think what's most special about providing hospice care from within Beata is that Beata has an almost 40-year history of taking care of people in their homes with compassion, with excellence, with reliability. Hospice care is a subspecialty practice of that tradition and that system of care that ensures it continuously, today, yesterday, and into the future. Compassion fits into hospice care because it's the basis of trust and it's the basis of relationship. Compassion, empathy, being heard are part and parcel to hospice care. What our aim in hospice care is to make the person living with an illness that is terminal feel like a whole person, feel like a worthwhile person, feel like a person who still has something to contribute to the world. And that trust from which that springs begins with compassion, making them feel like from my heart, from my mind, from my team's heart and mind, they're cared for wholly. Excellence fits into hospice because hospice and palliative care are evolving so quickly. When I talk about palliative care, that means many of the services provided by hospice for a patient who doesn't yet have 6 months or less to live. There's a tremendous amount of research and new knowledge coming out from all of the disciplines involved in hospice care about how we can do things better, how we can look at ourselves and say, how can we manage pain better? How can we measure shortness of breath better? How can we make sure that the families are feeling supported in the way they want to feel supported? Hospice care at its core is still a philosophy, but hospice in its practice has evolved tremendously in the last 30 years, and excellence is keeping those two traditions alive and well. Reliability is important to a hospice patient because they're in their most dire moment of need. If I've told or one of our staff has told a patient that they're going to be there at a certain time, we have a responsibility, we have a duty to them, to our profession, to Beata, but most importantly to them, to be there when we say we're going to be there, and to be there in a frame of mind that's reliably receptive to embracing the patient and what their needs are in that moment. Reliable also is more than just arriving on time. It's reliably coming to a patient's home in a frame of mind that shows you're ready to take care of them in that moment. The part of the Beata way that's most important to me is that all of our employees, myself included, show love for their patients. And it's not something that we're told to do. It's certainly something we're encouraged to do, but that it's so clearly stated that that's part of our work, that you show love in how you care for people. Yes, you bring your excellence, your knowledge, your reliability, you show up. your compassion, but that we speak about showing love and we do it in practice on a daily basis. And I know, as a physician, that all of our employees, no matter what type of service they're providing, will and can show love for their patients. So I know as a physician that no matter what the service, employees show love. So what does that mean to show love? It may mean spending a couple extra minutes. It may mean getting up to get something for the person because you know that they want to get it and they haven't quite asked you yet. It may be not getting the tissues, but just holding their hand while they need to cry. There's an infinite number of ways to show love for patients and the people we take care of. There are an infinite number of ways to show love for the people that we take care of and their family. But it starts with the heart of the person. And to do that on a daily basis takes a whole team, and behind that team takes a whole company. And behind that company takes a higher philosophy that we all ascribe to very, very willingly and happily, very willingly and happily, which is the Beata way. I think the thing that makes Beata most special, what I'm most proud of, what differentiates it for me from any other previous employer, is that it's written down that we show love for our patients. Now, I felt like showing love for my patients from very early on in my medical training, and you might even think, well, gosh, why are you showing love for your patient? What's that mean? In Beata, it's written down. You show love. You bring your personality. You bring your creativity. You bring your flexibility. You bring your expertise to the patient in their home. Showing love can be an infinite number of things. The difficult part is to do it reliably and over. When it's written down, when you know that not only you, but your colleagues all over the country are also showing love in their work, it builds strength and it builds confidence to do it again and again and again, and to take pride in it, to get better at it, and to feel that it's self-renewing, that you can show love, maintain your professional expertise, but do it for many years to come. Anybody going into healthcare is finding a part of their heart, part of their soul, part of their mind that they want to devote to caring for other people. I think that's a common thread through any person who enters healthcare. I hope it's a common thread. I believe that it's a common thread for anyone that enters healthcare. The Beata way, Beata's culture, is to have balance across all the qualities that a person in their home rightfully expects from every person who walks in their door. They're compassionate, they practice excellence, they're reliable. Much of what we look for in a Beata hospice employee is their competency, their skill, their communication, and the creativity and flexibility to adjust to what a patient and family needs. Maybe you've done it one way in the past, but this is a different person. We may need to change things a little to get it right for them. And that creates a lot of joy in the work. That creates a lot of confidence in the families that we're tailoring our, what we call the plan of care, how we're taking care of them under hospice, just to them. And that's part of Beata that makes it one of the most rewarding parts for me, that I know that I'm working with a team that brings energy, flexibility, creativity into people's homes. At the same time that they're respectful, they're probably going to learn something from this family. They need to listen. They need to watch. They need to act sometimes like it's the first patient they're taking care of, because this patient is only going through this once. We may have taken care of hundreds or thousands of other patients, but for this one patient, this is their one time to go through this part of their life. And the Beata employee, backed by the Beata way, backed by a whole team that aspires and does achieve excellence, compassion, and reliability in care, is a very, very special gift which Beata enables us to give over and over reliably. Mark Beata is our president, our founder. There would be no Beata without Mark Beata. Mark is an incredibly special and gifted human being, because the amount of heart that he puts into the planning of this company and to the amount of organization and skill he brings to supporting all of us in this very tender work. I frequently think of Mark when I'm in a patient's home, and I wish that so many of the patients that I meet and help take care of could meet Mark, because they'd see that he'd sit down, he'd shake their hand or maybe touch their hand. He'd probably well up or get a little tearful as he heard the story and listened to people. And he'd be there. He'd sit and be present and listen, be compassionate. If there was something he needed to do, if they needed a cup of water, Mark would get up and bring a cup of water back. If they needed help getting out of their chair and back into their bed, he'd help. He combines that degree of extremely brilliant innovator for healthcare with the humility and the respect for the individual. And I attempt to bring some of that spirit into every meeting that I lead and every patient home that I visit. I think that doing work within healthcare, doing work that's as difficult as taking care of people along their dying course, requires leaders who inspire. Mark is a leader who inspires. I try to be a leader who inspires, because there's the knowledge, there's the compassion, there's the reliability. It's instilling in the people that we work with and in ourselves that special gift of always reaching higher, always trying to do better than we did last time, always remembering that this is the first encounter this patient and their family has probably had with hospice. It may be their last. Every moment counts, every word counts, and strong leaders like Mark sets the tone for all of our leadership in Beata, right down to our local level. That's how it should work, and that's how it does work. The hospice practice within Beata is a specialty practice. Those of us who do hospice, whether it's in the office or in the field, we do hospice. We take care of hospice patients. As a physician with specialty training and certification in hospice and palliative medicine, it's very important to me that every member of the team, from the volunteer who's been trained in hospice to the social worker, the nurse, the spiritual care counselor, our administrators and office staff, that they're all focused on hospice, that it's an expertise, and that it's a specialty service during people's most tender and vulnerable moments. When a person asks me, what should I look for in a hospice agency? What should I really define before we make this step to receive hospice services? I usually recommend that they start with an informational visit from a representative from the hospice. I recommend that they ask about night call manager systems and how long it takes if there's a crisis in the middle of the night for a nurse to come. I also recommend that they ask about the psychosocial team. Will there be a spiritual care counselor? Will there be a volunteer? Will the social worker come out, and with what frequency, to help with non-medical and non-nursing aspects of the individual's care? As a physician, I highly recommend picking a hospice agency at which the physician, the hospice physician, can come out to the home and be a help. That may be to review medications. That may be for a specific symptom. It also may be to reassure the family that they're being taken care of by a caring doctor on the hospice side, in addition to their community doctor. That's a feeling that sometimes can only be given by coming to the bedside and meeting them. And I think it's a really important thing to preserve within the hospice care we deliver.